We're going to talk about the fact myself and Dr. Chilukuri, a great dermatologist from Houston. I'm excited to be working with him like usual because we're both innovative, do a lot of social media, and we both use this device. The Aerolase technology, which is 1064 wavelength laser that we love in our practice because basically everybody gets it. And I just did a lecture on microneedling. I don't know who was in that lecture, but everybody gets that too. So I feel like my monthly combinations are always some sort of microsecond pulse technology, some sort of traumatic collagen induction therapy, and some sort of energy-based device, along with your facial and your at-home skincare. If you do that, your skin's gonna look amazing. So if someone comes up to me and says, what do I do? That's what I do, okay? And I'll go through, a little bit of who's going to be speaking. Dr. Chilukuri, board-certified dermatologist, laser and fellowship trained, amazing dermatologist. He's going to give you some great lectures afterwards on hyperpigmentation. I'll be talking a little bit on acne and the treatment of acne and then just rejuvenation overall. It's a great picture, I guess. It's very, very cool. Nice little smirk there, So, but again, you got to be your brand, you got to resemble what it is. So when people say to me, what do you use? I tell them 16 skincare products. Every week I do an at-home mask and a micro-rolling. Every month I do a laser. I do this every 2 weeks. So it's, it's your workout for your skin. If you're not doing it, you're not going to look healthy. You're not going to be good. You got to do that to keep things up, and you have to convince your patients of the same. This technology works. When I first got it and was asked to do a bunch of studies, I was like, nothing's going to happen with this. Patients don't even feel it. It's like a massage. Like there's nothing going on. But the reason is because it's delivering such a high power amount of energy in a very short period of time. So it bypasses the normal time that your skin is able to sense that there's an issue up on the surface and or creating a burn. Obviously, if you do anything in the same place over and over, if I were to hit your shoulder over and over, you're going to get a bruise. Something will happen. If you do this over and over in the same space, you can get energy to build up. Now, we can talk about that later with advanced uses of this device and the fact that we maybe want to do that when we're treating some scars to get a buildup of energy to break apart a hypertrophic scar or keloid. But in general, global rejuvenation, acne, we don't really want to do that. We want to get the energy deep into the skin to not only stimulate collagen production, but attract certain chromophores, for example, water, melanin, and hemoglobin. And the best thing about this device is because it goes that deep, it's able to really treat all of those conditions at once. And in actually a very short window of change. So it's actually easy for someone to be learning how to use this device because there's not that many energies that you really need to know how to do, and it's very based upon the treatment of every sort of skin type. Water is going to give you that collagen production and tightening. Melanin is going to go for the age and sunspots, melasma, etc., and post-inflammatory hyperpigmentation. This is one huge problem for my Indian, African-American, Latin, mixed ethnicity patients. They get any little scratch and forms a pigmented mark. And obviously, that can be on buttock, that can be on legs, anywhere women shave. It's always a huge issue. So we can treat the hair, we can also treat the pigment at the same time. And you can combine that with things like your facials, your peels, your skincare, etc. And then hemoglobin, obviously you want to attract the blood vessels to treat not only redness, but dilated blood vessels like from rosacea and such. But those patients are very sensitive. Typically, you do lasers on them, they flare up. It causes issues. This will not do that because it's calming. It's deep. It's not affecting the surface. It's bypassing the epidermis down into the dermis where the majority of the skincare problems are, except for the sun damage, which is typically on the surface itself, which we can then use the erbium resurfacing for that if we really needed to. So it's safe and effective, it's comprehensive, again, it's focused, and it enables us to really treat many different types of skin. And one of our favorite treatments really is for acne. How many people here, well, everyone's not a dermatologist, obviously, but how many people here were told you can never do a laser while on isotretinoin? Okay? That's Accutane. Well, it's really not the name of it anymore. How many people do laser treatments or microneedling or peels while patients are on Accutane? Me. I'm one of the only ones. And you know what? Every patient gets better. Because if you choose the right technology and you understand the science, obviously I'm a dermatologist trained, did two fellowships. It's a little bit different what lasers are now, okay? 20 years ago, lasers burned the skin. It made people, regenerate from nothing. It's like an explosion, and all of a sudden everything has to repair. It's not what we do anymore. There's almost no repair process. It's stimulating processes that you can't even see that are occurring. Well, why would that be bad when the skin's remodeling itself like Accutane? It's actually better. It ends up showing in my studies, it shows the scars disappear very quickly without an ablative laser. So you can do this treatment while patients are on Accutane. You can do this treatment while patients are sensitive. You can do it when they have terrible cystic acne. And there's a lot you can do with it because they improve. And the proof is by doing experience. And the thing is, there's many patients that have acne, especially the women, as they start to age and hormones change and they have kids, there's adult acne. And women always come in saying, why did you get this? I say, frank bad luck. But we have treatments for you now. You know, we can give you spironolactone, we can start Accutane, you can do lasers, we can do facials. There's stuff we can do. And we can get rid of it because everyone's depressed or has anxiety. And if I was to throw in a video here, I would tell you to go to my YouTube video and just type in Accutane and laser, and it comes up because it's already been, even the AAD has like tried to get me to take it down. But long story short is, it's proof that patients are depressed when they have acne, and when they don't, they're not depressed anymore. Because all the studies show that if you improve the way someone looks, they feel better about themselves. Accutane, in my opinion, does not cause depression because patients are depressed when they have bad acne. They're going to be depressed until it's better. So this is what we need to do. We need to treat patients and get them, much better. And obviously, when someone has terrible cystic acne all the way to even comedonal acne, in my opinion, comedonal acne is sometimes even worse than some of the cystic acne because it's hidden. It's like the stealth acne. It's waxy, it's under the skin. It's always going to cause an internal inflammation that's going to make pigmentation and scars. So again, that sebum gets produced, and then obviously over time, it builds up and they get scars, and patients are really frustrated with the fact that they're using creams that are so expensive. You can ask my staff, and I treat so many acne patients for cosmetic purposes only. I don't take insurance. And my patients spend less money with me than the prescriptions that they have to pay for. So they would rather come to me and get lasers that are going to improve them. And because the prescriptions, like something, like Epiduo, for example, could be $1,000. That's insane. To me, that's a treatment that just dries you out and only should be used as a spot treatment. That is not cosmetic. Cosmetic is not making someone flake. Cosmetic is making their skin radiant. You can't do that with these prescription products. They're not designed for that. So what we need to do is open up our minds as to how we treat these alternatively and focus on each of the areas, the sebum production, the inflammation, the bacteria, the clogged pores. You need to, and obviously they're telling you here that the laser does all of this. That's true. It decreases some inflammation. It opens the cysts. However, you need to have extractions. You need to have peels to exfoliate. You need to do other types of lasers in combination to get resurfacing. There's other things that need to be done, okay, to treat the acne as well. But if someone could only afford to do one thing, this would give them a really big improvement. Perioral dermatitis, acne, that rosacea acne overlap, it's very useful for treatment because the laser itself goes all the way down, deeply penetrating into the sebaceous gland, basically shrinking the glands and the pores. And it's much cheaper for a patient and also better for the doctor to have these type of things. You just got to package it. A patient comes in with acne, you're like, look, every month you got to spend $300, and this is what it is. You want to be better? This is what it is. You're going to get a facial, whatever it would be, a light therapy, a facial, and a laser, and that along with your topicals, and you're going to get improvement. And in my opinion, if someone says they don't do it, I don't treat them because they won't get better. And then someone's going to come back to you later and say, I want my money back because I didn't get better. Just doing one thing is not going to be enough. But this treatment will be a lot more improvement for them, especially in the patients that have done everything and nothing's really worked because they haven't done these energy treatments. And you can see here, obviously, they keep going about the revenue to you. There's a very high revenue one. There's really no consumables except for one little filter that's on there. And there's different tips that can be used for different things. And I'm going to show you guys for acne the use of two different tips. When I treat scarring and post-inflammatory hyperpigmentation, we also use two different focused beams. With melasma, you may only use one focused beam, and then if you use the erbium resurfacing, that could be another laser/tip that you would use. It's very quick. Patients see results right away. It also feels really warm, but yet has no downtime. And it's just a nice, cost-effective alternative in combination, in my opinions, with the facials and the peels and the other things that you should be doing when you have bad acne. But in general, you see here, I mean, it can give a really good improvement. Now, in my opinion, acne like this will never clear itself and just a laser. It's always going to come back. He could wait 1 year and it's going to come back. So unless he's maintaining this forever, it's going to come back until it dies itself out, maybe in the mid-20s or the 30s. That's a long time to wait. In my opinion, these patients should be treated with Accutane with this medicine, with this laser at the same time. But it's still going to give a very significant improvement. And you can see here, this patient had already failed Accutane and then used this. That's another thing I talk to patients about, is the combination effect of treatments together giving you a better outcome. This person probably failed because either not high enough dose, not on it long enough, didn't do a combination treatment. How many dermatologists tell patients, you're on the pill, you don't need anything else? That's not true. The skin's drying and flaking off. You need it to be hydrated. It needs to be treated. It needs to be peeled. It needs to be lasered at the same time. This is one of our patients, a concomitant treatment. Very good improvement, very good improvements here. Also just treating the redness. And again, remember that waxy inflammatory acne always leaves these ice pick scars. People hate the ice pick scars. You don't see them straight on, and then you walk into an elevator and there's a side light and they freak out. They think their skin looks horrible because there's terrible scarring there that you need to treat because it makes people very depressed. Acne, again, improvement, and over time you're just going to see improvement. I have yet to see anybody that didn't get an improvement from this laser. So are we going to show a little demo right now? Great. So let's do a little demonstration on a patient of mine that has very mild acne. But again, this laser is deeply heating. It's a 1064 wavelength, so it goes deeper, and it basically the heat is going to generate collagen production. Do we get to see this? This is fantastic. Now she just said to me, "Don't worry, I had Fraxel." I love that because Fraxel hurts. Anybody that's had Fraxel, it hurts. This feels like a massage. If you have a spa, you should have this done at the spa. You could be doing the leg at the same time while someone's got a mask on. Do their hair and their legs. It's not even that painful. Treat their face before you do a facial. Do an enhanced facial, whatever you want to do. But this basically should be done by everyone. Actually, I'm going to lower it because I'm going to make a point here. Even at a low energy level, you're not going to even feel this. So I'm going to test this out on you. So okay, so everyone, can they see? Beautiful, you can see. Okay, so just so you know, this is a little loud. I always know when this is running in the office because it makes a loud noise, but we know it's working. So I'm going to do a little pulse on your lower face, and you're going to tell me if you feel this, okay? So just tell me, are you feeling this?
No.
No. So we're just going nice and slow, even pass, and what you normally would do is what we call globally heat. We would deeply globally heat the area, and then we would spot treat any specific cysts, inflammatory areas, pustules, etc. So I'm just going to do a pass or two. Now, when you have some vellus hair, like you have little baby hairs, I always tell people they should do dermaplaning beforehand so that the hairs don't get away of the laser. So I'm just going to go back and do another pass. Do you feel it yet?
No.
No. Okay, now let's go up. She's got light skin. So let's go to a real setting, okay? Now, this is a real setting, okay? Tell me, do you feel it?
It feels like a hairdryer.
Feels like a hairdryer. Well, that's not bad unless you're a little puppy. Some of those get scared. But you're totally fine. I mean, this is a strong heat. If you actually look at the joules that are released with every pulse of this, it is very strong. But again, when I first got this laser, I'm like, nothing's happening because you don't feel it, but it's really working. It's deeply heating. And if I do 4, 5, 6 passes, it's going to get a little hot. And you'd be able to tell me, look, I'm starting to feel it, but it's more warm. Do you yet feel it or no? Not bad.
Yeah.
Do you do yoga?
Yes.
You do. So here, let me tell you something, okay? The people that do yoga who have had multiple kids or have heavy periods, this is what I tell them, I'm serious. They can tolerate the highest setting of this because they're used to like hot yoga and the stretching and all the pain that's associated with this is nothing. So it's like, you can increase the heat. So you have to ask people, are you a yogi? Because they need higher settings. They feel it. They don't even feel it. But look what's happening now. The cheek is starting to become a little red. Do you feel it yet or no?
Yeah, a little bit.
But how much? Like a 0 to 10, what would you say?
Like 5 or 6.
Okay, so it's starting to get, so about that 6 to 8 range, it's heated, it's fine. feel your cheek a little bit. Just feel it. What do you think? How would you describe it?
Warm.
It's warm. Exactly. So now what we'll do is, that's globally heated. So now we'll switch over. We're going to change. You want me to show them here? We're going to change to our focused lens. And I use this a lot, actually, for various things. But we're going to focus on if she has any little pustules or anything, or any cysts. But you could use this for blood vessels. You could use this for scars, keloids. What'd you say? Anyone say anything? So we're going to go down a little bit. Now look, this is about 2 millimeters. So you can see if we go real close here. So let's spot treat 1 or 2. Let's just pick a spot and go 1, 2. How does that feel? But was it bad or no?
No.
So let's just pick 1. Now usually what we do, now she looks really good. Now if she looked really bad with acne, we'd want to see a little discoloration that occurred in the area. Turn to me. Just want to see if you have any other spots. Your skin looks great. You're lucky. Your skin looks great. So this is a perfect treatment for you. So any of these discolored areas, we're just going to spot treat them. And I went down a little in energy. You see, it just gets a little bit darker, no big deal. But when you have an actual cyst, you may want even a little dusky of a look. Sometimes that means 2 pulses to kind of just get right like that. You see how that darkened a little bit? That would be perfect. So let's just see if there's any other spots. Now, you can do this for pores. You could do this just in the area for pores, and we would just spot treat these areas. Turn a little bit the other way. And you can see now, take a look. Look at where we treated those cysts. Can you see? Turn your head all the way to the right. Perfect. Can you see that right over here? You guys see where we treated right there? How they inflamed? That's exactly what we want, because that means that all that energy got directed right into that cyst, perfect, and is going to work to do its anti-inflammatory, etc. Do you want me to finish the other side later?
Yes, please.
Okay, I will.
Let's move on to hyperpigmentation. How many of you guys love treating hyperpigmentation? We got 2. There's always a unicorn. There's a few. Okay, we got a few unicorns. Thanks. Patrick, you like treating everything, but you're smart enough to treat all of them well. That's Dr. Patrick Bitter. I was always saying he's the one who taught me using an IPL once a year is like going to the dentist. That's what I tell every single one of my patients. You told me that a few years ago, and I literally say that every single day because we do combination therapy. Thanks, Jason. There's always so much that I learn when I get to see you. So let's talk about hyperpigmentation, because I hate treating hyperpigmentation. Absolutely hate it. I don't mind the kind that comes from post-inflammatory. I don't mind the type that comes from sun damage, because that's things that we can treat easily. We can use chemical peels along with our combination therapy with the Aerolase, and we can get great home run results. And what happens with hyperpigmentation? What happens with this melanogenesis? Basically that melanocyte, so that's this little cell right here, is getting activated. On your basal layer, every 10th cell is the melanocyte. And when that gets activated, whether it's by the sun, by the wind burn that occurs, or any type of inflammatory process, it's going to be overactivated. And so then you can get different types of hyperpigmentation, right? We talked about UV damage. That's easy to fix, no big deal. And we know that along with the UV damage, you have these seborrheic keratosis. Well, what can you do for that? Well, we can use the Aerolase, or we can use some of the other products that are coming out, like Escada. We can use our chemical peels. We can use our liquid nitrogen. We have a lot of different things that we can utilize for that. Post-inflammatory hyperpigmentation. What's the best treatment that you can do? Dr. Bitter, you tell me. What's the best treatment for post-inflammatory hyperpigmentation? If you have to pick one thing. BBL. Perfect. I'm really simple. I like our patients to spend $4 at Walmart or Target and buy some triamcinolone. So it's a topical steroid. Let's calm down whatever's causing that pigmentation. Then we can apply the BBL, we can apply the Aerolase, we can apply peels and calm everything down and make that go away. This, to me, is the bane of my existence, melasma. Right? And why? Because I'm married to a lovely young lady who I married above my pay grade, but she has melasma. She developed it 11 years ago when we had our first child. And up until we got the Aerolase, Joe, when did we get the Aerolase? 2 years it's been, I think. And so up until we got the Aerolase and we started using chemical peels with PCA, as well as using a special retinol from PCA, this was literally the bane of my existence. My wife would look in the mirror, can't you do anything about this? I said, no, let me refer you to Dr. Bitter, let me refer you to Dr. Emer, but please, let's go to a different state, right? Now we have things that we can do. And so when we talk about what melasma is, we talk about this hyperpigmentation. It's usually symmetric. Usually it's in the areas on the forehead. It's going to be on the upper lip. It's going to be along the sides of the cheeks, around the eyes. Very, very common distribution. Men can get melasma, but it's a little bit less frequent. It's in about 10% of males. Why do we get melasma? And you heard Dr. Emer asking those questions. You know, are you on birth control pills? Well, we don't know exactly the cause. We know it's multifactorial, but we know two things for sure will aggravate anybody who has that predisposition. Number one is going to be sun exposure. So what can we do about that? Well, use a physical sunblock. What else can we do? We can use a sunblock that has antioxidants inside there. And there's one that came out 2 years ago, and I'm not getting paid by PCA, not by PCA, by Skin Medica, but it's called Total Defense and Repair. And my wife has been on that since July of 2016. And in the summertime, she uses it twice a day. You say, why the heck would I put sunscreen on before I go to bed? That doesn't make any sense. And it's because it has 4 antioxidants that work at 4 different areas of this melanogenesis. One, it calms down the melanocyte production. Number 2, it decreases the number of melanophages, the little pigment cells that go inside the vacuole. And then number 3, it decreases the number of migration, or the amount of migration that goes up. So you can use that in conjunction with everything else that you're doing. What else do we know causes melasma? Heat. So we have several cooks that come in and they say, literally, I have never been in the sun. And I said, well, what type of work do you do? Do you not go to the mailbox? Do you not go running? Do you not do anything outdoors? Do you not go and get the garden hose? Don't you have a dog? Well, I work the night shift. I said, what time do you get home? In Texas, it's like California, like Nevada. The sun comes up early and it's brilliant. And they said, no, I'm a cook. Aha. That heat, the hot yoga, all of that can flare up your melasma as well. So then what do we know? We have all these different therapies. I always say when you have one condition that has a bunch of different therapies, there's no solution. Even combinations, we have to just work together to try to make it that much better. So we talk about the topicals that we can use. Where do lasers play a role? Well, recently one of our estheticians did a consult and said, I recommended that we use the Aerolase as the primary treatment. I said, okay, well, why? I always want to know why, right? And she told me, there's more dermal component. How do you know there's more dermal component? Well, you can buy a $30 UV light, or you can buy a more expensive woods lamp and look to see where that pigment is coming from. And again, I think you have a video on that on YouTube as well, so you can see what it is. So what do we know? The superficial pigment, we can treat with topicals. We can use our hydroquinone, we can use our steroids, we can use chemical peels. For our dermal pigment, how do we penetrate deep enough to do that? We can use our microneedling and use that as a device-assisted drug delivery system. We can use our Aerolase to actually penetrate deep enough to get in there. And we can also treat the vasculature that's a big component of melasma. Oftentimes, patients will come back. My melasma is not any better. I'm looking, I get the woods lamp out. I said, see the picture I took before? You're not hyperpigmented. But I still see all this, and I still see all this. Well, right, that's the vascularity. So we have to preemptively tell patients to expect that, and then we can use combination therapy again, like Jason talked about. So this is where the Neo really helps, and it's going to penetrate past the epidermis. You can also use it more superficially for the epidermis, but where it really shines is to treat that component, and then immediately afterwards, I put a chemical peel. And you can use your chemical peel of choice. You can use plain TCA, trichloroacetic acid, 15%, 25%, 35%, depending on what you're trying to use it for. You can use a PCA peel, which is called Sensi, S-E-N-S-I, and that has 6% TCA and a couple other ingredients. What's my favorite? I tend to use a peel, it's called a HQ peel, also by PCA. It happens to be by PCA, and they're not paying me for any of this, so you have to ask the conflict of interest, that's why. And what does that do? It does not have resorcinol or hexaresorcinol, which causes heat. So use something that's not going to cause more heat. So the TCA by itself, trichloroacetic acid, oftentimes it'll heat up the skin, and you can aggravate your melasma. So with this deep penetrating heat, where it's actually, and the laser is so focused with that quick microsecond pulse, it's going to focus that heat and get to the area where that is. And just like Jason was showing you in the live demonstration, it's going to help break it up. I do a just very slight differentiation than what Jason was doing. I'm doing it in a painting motion. So it's pop, 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 and we're painting it across those melasma areas. Now, I know Jason was treating regular hyperpigmentation from actinic damage, so it's a little bit different here. So what do we know? Well, why is it so unique? because now you're treating the dermal component as well as what you're already at home treating with your superficial component. So again, let's show some before and after pictures. And I think I only put one picture of one of our patients in here, and I did that on purpose because if it's all of my patients, and yes, they're getting better, and then you buy this device and your patients aren't getting any better, you're like, well, what is he doing different in Texas? It could be the water, right? It could be the type of pills that I'm giving that patient. But if we go across the board, so Cheryl Burgess is out of Washington, D.C., look what she got after a single glycolic peel immediately following the Neo. So what are we doing? We're breaking up that pigment so the body, the macrophages, can come and extravasate that faster, right? Look at the change here. After 2 treatments, Brian Johnson, I mean, that's a pretty dramatic change. So what else can we add? Something that's not in the US yet, but again, if you're a dermatologist or you're thinking about doing a lot of treatments for melasma, you can talk about tranexamic acid and oral format. Here we can get it compounded. Is it a 750, I think, 750 milligrams. You can split that capsule. Overseas, they're doing it quite often, and we'll see if it comes into the US. We can do topicals. I think this is mine. Yep, that's my lovely bride. And it doesn't project as well here, but this is after a single treatment with the Aerolase and using a TCA 6% with hexoresorcinol peel. Look at the change here. Michelle Henry, she's a young dermatologist out of New York. Excellent. And she treats a lot of skin of color. And look at the change, right? And again, is it the first device I go for? I don't go for any device right away. I want to make sure, just like Jason talks about, that that patient is going to partner with you. If your patient is not going to be compliant, it's not a partnership. It's not a relationship. It's a one-way thing where they're getting ready to blame you because this is not a cure. This is something that we're going to partner together and grow old together to keep treating together. But you can see nice changes again with Cheryl. Okay, you do see that some of the pores here look smaller, and then the side effect is that post-inflammatory hyperpigmentation after acne also improves. So that's just like Jason was saying, that's one of my favorite things, is that you do see the improvement of the acne as well as the post-inflammatory hyperpigmentation like you'd see in this slide here.
I mean, you think of this as a global heating technology that's increasing collagen. It just happens to be in inflammatory conditions, it's decreasing the inflammation. And in some instances, like for AirAppeal, for example, you can use an erbium laser on top, erbium component, to be able to resurface the area. And the reason, one thing that's good about this is, again, when you lower the second technology to be quick pulse, it's way more cooling than when it's a delayed ablative on the skin. So at this 300 microseconds, very cool. Most people will call this a cool laser. You guys know what I'm talking about, okay? Because the 2940 nanometers erbium is much cooler at a 300 microseconds, so it's basically a weekend peel if you're doing it the normal way, and it's very minimal pain. You could almost do this without any numbing. Some people will do, especially if you spot treat, but if you're doing full face. But what's nice about this is you can look that the depth, depending on pulses, is very controlled. It's very predictable as to how deep it goes. It's only a few microns. It's very, very safe. And so you can get this improvement in sun damage only in a few days after treatment. And you don't have videos of it on here, huh? Videos showing the ablation? No, that's okay. But take a look. You can see the reduction in pigmentation, even helps calm inflammation. That's the other thing that's interesting. So when you see sun damage, you don't realize the vascular component to sun damage. That's why skin cancers have blood vessels. There's a vascular component to it. So not only is there brown, there's always red. That's why when you're treating browns, you should also be treating red, which is what this laser does. So in my opinion, you should always be doing this with the ERA, or this with a non-ablative, or this with a peel, because you're treating the superficial sun damage plus the vascular component of it. And so this gives a very nice rejuvenation effect because you're getting the epidermis basically sloughing off, which is where all the sun damage is. And look at the wrinkle improvement, very good. I'm sure you could do a few more passes around the mouth to get even more of an improvement, but it's unique because it's very effective, and you can do this in all the skin types. And this is an ablative laser that can be done even in darker skin. Now, I wouldn't say maybe the darkest African patient may be, a little more risky. You could pre-treat and post-treat, kind of pick wisely. But in general, mixed ethnicities, Asian skin types, post-inflammatory hyperpigmentation can still use this treatment, and you could treat stretch marks, and you could do scarring, etc. Oh, good. Are we doing, let me finish the other side, and then we'll do the melasma. Yeah, that'd be great. So I'm not gonna leave her with one cheek that looks better than the other, because it's not fair. So I'm gonna treat the other side, and I can answer some questions if you want during that time.
I actually have a question.
Yeah, what's the question?
So, during my teenage years, I had acne all around my mouth.
Okay.
A lot of my scarring is around here.
Yes.
Could you suggest this moving forward for my acne scars, like in
Perfect.
Mariner lines?
Yeah,
right here?
let me talk about that. So her question was, throughout her teenage years, she had a lot of inflammation and acne that caused scarring. And if you look at her up close, which is hard for you to see, but if you look at her up close, there's a little bit of ice pick scarring, there's irregular texture. I call this cobblestoning, okay? This is not just, identified specific type of acne scar, it's just irregular texture, and her surface doesn't look great, okay? She's very beautiful, but she'll feel better if her skin was smoother. So what I would do is I would combine this with the Era. And that's what I was saying before. I would do treatments of that probably every month to 6 weeks for 3 to 6 treatments. And then I would get on your monthly plan of doing the LightPod Neo as your collagen production over time and peels and microneedling and stuff for your surface regularly. You don't need to do erbium resurfacing every month, but you could do it initially a few times to get a bigger improvement and then start maintaining that with other lasers at the surface. But for anti-aging purposes and for acne, you want to keep that heating stimulation going, and that's why we would include doing the Neo, okay? And that's what I would do. You do that type of combination, and you would also do well with peels. You have the skin type, although if you look at your forehead, you actually do have a little bit of melasma. And some might say that's photo damage, but it's really hormone-induced pigmentation from sun. And do you take birth control, can I ask?
Not anymore.
Oh, but did you before?
I did.
And did it ever cause pigmentation on your skin?
No.
No. So you may have a residual of hormonal effect causing pigment. So this will help. And so when somebody has that going on, we do a few passes, somewhere 2 to 6 passes in the area of pigmentation to get stimulation of those dermal cells that will break apart the pigment and remove them, almost similar to tattoo removal in a way, because we're not exfoliating. Remember, we're not burning the skin. We're stimulating the skin to remodel itself. How does this feel?
Okay.
Hurt or no?
A little bit.
Well, so that's why I wanted to bring this up, okay? So on the forehead, if there's any hairs, you see that? Can you see that little spark? Turn your head a little to the right. Just want to show them this. So we're going to go down in the energy, but I'm going to show them. So watch really carefully. She's going to have some little sparks. And that's because those are little fine baby hairs that are being attracted there. Did you feel that a little more? Okay. Turn back to me a little bit more. There you go. Now, we'll get one more pass and we'll go down. But in general, we just keep doing these passes to get her pigment to be stimulated. And just like when you do non-ablative lasers, the pigment rises to the surface or gets darkening, this can happen a little bit here too, which is what's stimulating the cells in the body to want to remove it. And in general, then I would do a peel, or I would do a laser, low density, low energy laser, microneedling, PRP. Turn all the way to the left. There you go. Good. Always try and hold this 90 degrees. Follow the same pattern. And, this is what I also like about this treatment, which is a pros and cons for everybody, is this gives you some time to talk to your patients. So I could sit here for 15, 20 minutes, now convince you to do everything I have, which I'm not going to do, but I'm going to tell you what's important for your skin. And this is the time, you really can't listen to anything else. So either you're going to tell me to shut up or I'm just going to keep talking. And that's what's going to happen. So then, unless we have goggles that transmit my menu of services, which I want to create, which I think would be a great idea. You could put some sort of hypnotic device in those goggles. You're going to just listen. So we're doing the treatment. We're getting a second pass. And how does the pain in the second pass? Not too bad. So yeah, the forehead, hurts a little bit more. It's thinner. It's a thinner area closer to bone. So I want to show everybody because you have a good response. I don't know if you can see. Can you put your chin down a little bit? And lean up just a little bit like this. Yeah, now go up a little higher. So you see how red she is up here? That's perfect. And if you feel with the back of your hand, it's very hot. Very hot. That's good. Okay? Turn now to the other side. I'm going to do the other side of the cheek. Why don't we go, Dr. Chilukuri, do you have any questions from the audience?
Anybody have any questions that we can start answering?
By the way, I will not be able to hear, so he's going to have to repeat it to me.
So, Jason, they're asking, what was the setting when you're treating the hyperpigmentation?
What is the setting?
Right.
Well, the setting depends on the skin type. So in general, someone with this setting, and we can take a look over here, I'll show you. There's different treatment levels, okay, and energy modes. Typically somewhere in the 5 to 8 range, a lighter skin type can do. But we start usually around the 3 to 5 range for darker skin or beginning.
Young lady, I don't think, right?
If they have it even on the back, that crisscross look, do peels and lasers there. It's okay. So what we'll do is I'll just show you what we would normally do is we would do those few passes, and then right away we would go on top, whether we do a peel, whether we do another laser. But in general, we're following these areas of hyperpigmentation. You could spot treat these too, but if we really want overall for him to look better, how does this feel? Now I'm a little stronger on you and you have hair.
A little warm.
It's just a little warm. But do you feel anything in the hair?
I feel like little pokes.
Like little pokes. Yeah, so with men, now obviously you could potentially, decrease the hair a little bit at high levels. So when we're globally treating, we would go a little bit smaller for him in the level so we don't reduce his hair, but then we would go on top and do the erbium. Now, is it starting to build up or no?
It is. It's getting a little warmer.
What does it feel like now?
The heat feels the same. Just feels like a poke.
Just more of a poke.
Yeah, a little deeper toothpick.
Got it. More of a deeper toothpick. Okay. Well, that's great. We would just go 3 or 4 passes up to 8, depending on what you can tolerate. And then we would work our way from there. And then again, I would go down here where he has all that sun damage. If I move his shirt over, you can see there's no sun damage over here. And you can clearly see this line right here. And we could treat that area too. So let me treat that just a little bit. Because I have a question for you. Do you feel that? Not like the face. So let's just stay in one area for a second. Is it starting to build up? How much? 4 out of 5. Yeah, because this area is thinner and it's very close to bone. And there's hair. So again, you're going to build up. So we're just going a little bit smaller. But in general, that's what we would do. We would treat the vascular component and the pigmentation component. And then we would decide, do we resurface? Do we peel? Etc. for your long-term plan. But how was that intolerability? Like nothing. So if you were scared of lasers, would you do this treatment again? Absolutely. Exactly. So that's the point. The point is it's safe and effective on people that probably wouldn't want to do treatments. And you're talking about acne and patients that are younger that are nervous about doing treatments too. It's very easy for them to do.